committees also develop standards for manufacturers, which recommend the labeling, safety, and performance requirements for the products they produce. Definitions. Standards, AAMI standards. Voluntary guidelines representing a consensus of AAMI members that are intended for use by healthcare facilities and manufacturers to help ensure the medical instrumentation is safe for patient use. Technical information reports, TRIs. Reports developed by experts in the field that contain valuable information needed by the healthcare industry. TRIs have not undergone the formal approval system that standards are submitted to and may need further evaluation by experts. TIRs may be revised or withdrawn at any time because they address a rapidly evolving field of technology. AAMI publishes many standards and TIRs. Many of these address functions that affect the Central Service Department, including cleaning, sterilizing, packaging, and equipment testing. In 2010, AAMI released its best-selling healthcare document, ANSI AMI ST79, the Comprehensive Guide to Steam Sterilization and Sterility Assurance in Healthcare Facilities. This document quickly became one of the most widely used documents in CS. ST79 is used to write policies and procedures and serve as a reference for best practices. Although the title states the document was related to steam sterilization, many sections of this document address processes that affect all types of sterilization, such as cleaning, packaging, indicators, product verification, education, and departmental workflow and design. This document became more important to CS departments in 2011 when the Joint Commission, TJC, surveyors began referencing ST79 during facility surveys. Although AMI is a voluntary organization, AMI standards are considered a key resource for healthcare guidelines, as many of their documents have been approved by the American National Standards Institute, ANSI, ANSI. Non-compliance with these standards is cited by regulatory organizations that inspect healthcare facilities. CS technicians should be familiar with current AMI standards that address many of these processing and sterilization practices. For more information, you could go to the AAMI website. American National Standards Institute, ANSI, ANSI. Founded in 1918, the American National Standards Institute, ANSI, primary mission is to enhance the global competitiveness of U.S. businesses and the American quality of life by promoting and facilitating voluntary consensus standards and ensuring their integrity. ANSI represents the interests of more than 125,000 companies and 3,500,000 individuals. ANSI does not develop American standards. However, it does provide a neutral arena for its interested parties to work toward agreement. ANSI's committee membership is similar to that of AMI. Standards are submitted to ANSI for approval from other organizations, such as AAMI. Examples of ANSI-approved standards include the standards developed by AMI. ANSI is the sole U.S. representative to the International Standards Organization, ISO. The International Standards Organization is discussed later in this section. The Association of Perioperative Registered Nurses. The Association of Perioperative Registered Nurses, or AORN, AORN, is a professional organization consisting of perioperative nurses and others who are dedicated to providing optimal care to surgical patients. AORN's committees are comprised of AORN members and allied association members who develop nationally recognized evidence-based standards, recommended practices, and guidelines. AORN's guidelines for preoperative practice currently have several sections devoted to topics already affecting CS departments. These include sections on cleaning, disinfecting, packaging, endoscope reprocessing, and sterilization. Although the standards are required annually, most standards are on a 5-year review cycle. AORN, like the other professional associations being discussed in this chapter, is not a regulatory agency. However, regulatory officials look for compliance with AORN recommended practices. CS technicians should be aware of AORN recommended practices and guidelines that relate to instrument processing, as many of them are incorporated into departmental policies and procedures. These documents are also utilized by surveying agencies when reviewing the CS area. For more information about AORN, go to the AORN.org website. The Association for Professional and Infection Control and Epidemiology. The Association for Professional and Infection Control and Epidemiology, APIC, APIC, is a voluntary international organization whose members work to prevent HAIs, healthcare-acquired infections, or hospital-acquired infections, in healthcare facilities. APIC members work in conjunction with other agencies such as the CDC, Centers for Disease Control, to adopt standards for infection and disease prevention. Examples include the Bioterrorist Readiness Plan and Guidelines for Infection Prevention and Control in Flexible Endoscopy. CS technicians may interact with their facility's infection preventionists when they conduct departmental surveys to ensure compliance with APIC standards, practices, and guidelines. Infection preventionists may also be in the CS department to collect and analyze health data relating not only to HAI, but regarding employee health issues and trends within the department, or to provide in-service education or infection prevention topics. TJC, the Joint Commission, holds the Infection Prevention Department in conjunction with the CS department staff responsible for cleaning and sterilization outcomes within the CS department. For more information on the Association of Professionals in the Infection Control and Epidemiology, go to the APIC.org website. The International Standards Organization. The International Standards Organization, or ISO, is a non-government organization with a network of national standard institutes representing 163 countries. International standards give state-of-the-art specifications for products, services, and good practice, helping to make the industry more efficient and effective. ISO standards are voluntary and the organization has no legal enforcement authority. However, many ISO standards have been adopted by some countries or are referred to in legislation, which makes them regulatory in these jurisdictions. Proposed standards are submitted from members such as AAMI to general membership and are granted ISO status based on consensus of the entire membership. It is a growing trend within the healthcare industry to become ISO certified. Once certified, CS departments may be a part of an annual survey that is similar to CMS surveys. However, the ISO focus is more results and problem resolution oriented. For more information on International Standards Organization, go to ISO.org. The Joint Commission. The Joint Commission, or TJC, is a private, independent, nonprofit organization that develops standards for healthcare facilities. TJC personnel evaluate healthcare organizations and programs in the U.S. by conducting on-site surveys at least every 3 years. The TJC teams will arrive unannounced at a facility and spend 2 to 5 days studying virtually every aspect of care within the facility. TJC accredited healthcare facilities are reorganized as those that are dedicated to quality practices. TJC standards are voluntary. However, they carry significant weight. Failure to comply with these standards as evaluated through the TJC survey process may result in a loss of accreditation by federal and state governments. This, in turn, may result in the forfeiture of millions of dollars in Medicare and Medicaid program payments. CS technicians must understand and cooperate with their facilities' procedures to comply with the TJC. They must know and promote the hospital's mission and consistently comply with all safety standards, including those specific to their departments. They must attend all mandatory hospital in-service sessions, assist with the quality improvement tactics for their specific function, and follow all directives of infection prevention personnel. TJC emphasizes continuous quality improvement for patient care, and CS professionals play a key role in improved patient outcomes. TJC standards may be incorporated by reference into federal, state, and/or local statutes, and then become binding on healthcare facilities. For more information about the TJC, go to jointcommission.org. National Fire Protection Association. The National Fire Protection Association, NFPA, is an international organization that works to reduce the burden of fire and other hazards around the world. The NFPA members represent nearly 100 nations and organizations and use a consensus process to develop codes and standards that influence building safety in the U.S. and other countries. The NFPA is important to CS technicians because of the fire safety standards used for the building in which they work. The NFPA standards address the fire burden of all disposable packaged items, such as a surgical draping, gauze sponges, stored and used within the facility, the fire standards for patient drapes utilized in the OR, and wrappers utilized in the CS process departments. For more information about NFPA, visit nfpa.org. The United States Pharmacopoeia National Formulary. The United States Pharmacopoeia National Formulary, or USP-NF, creates and revises standards for the purity of medicines, drug substances, and dietary supplements. These standards are published in the USP National Formulary, NF, standard publication. Standards are set for packaging, labeling, bacteriological purity, pH, and mineral content. The USP is important to CS technicians who work with purified water or sterilizing water for irrigation. For more information about USP.NF, visit usp.org/USPNF. World Health Organization. The World Health Organization, also known as WHO or WHO, is an agency of the United Nations that was established in 1948 to further international cooperation in improving health conditions. Its major task is to combat disease, especially key infectious diseases, and to promote the general health of people worldwide. WHO staff members coordinate international efforts to monitor outbreaks of infectious diseases such as severe acute respiratory syndrome, SARS, malaria, acquired immune deficiency syndrome, AIDS, and Creutzfeldt-Jakob disease, CJD. This agency provides a central clearinghouse for research services and international standards. Agencies such as the CDC base many standards on the research and direction provided by WHO. For example, the standards healthcare facilities follow for processing items contaminated with CJD are from WHO. For more information about the World Health Organization, visit who.org. Society of Gastroenterology Nurses and Associates. The Society of Gastroenterology Nurses and Associates, SGNA, is a nonprofit organization of nurses and associates dedicated to the safe and effective practice of gastroenterology and endoscopy nursing. SGNA collects information and establishes standards and guidelines relating to reprocessing flexible endoscopes. In 2013, SGNA released its guideline for the use of high-level disinfectants and sterilants for reprocessing of flexible gastrointestinal endoscopes, followed by another publication, Standard of Infectious Control and Reprocessing of Flexible Gastrointestinal Endoscopes, in 2012. Both of these documents may be downloaded free of charge at the www.sgna.org site. For more information, go to sgna.org. Canadian Standards Association. The Canadian Standards Association, CSA, is a non-profit organization that develops standards for industry, government, and healthcare for all Canadian provinces. The CSA has developed many standards for reprocessing of surgical instrumentation. For more information about CSA, go to www.csa.ca. European Committee for Standardization. The European Committee for Standardization, CEN, sets the standards for Europe in much of the same way that AAMI sets standards for the U.S. The 33 member countries have adopted CEN standards exclusively. U.S. companies that sell products for instrument processing in Europe must follow CEN standards for the products sold in member countries. Conclusion. Standards and regulations are designed to keep both patients and employees safe. Central service technicians should become familiar with the agencies and organizations that develop the requirements that impact their jobs and should strive to keep abreast of changes as they happen. Doing so creates an environment of safety and competency. Terms to remember: statute, regulation, standard, regulatory standard, voluntary standards, best practice, MedWatch, greenhouse gases, Medicare, Medicaid, Health Insurance Portability and Accountability Act, also known as HIPAA, H-I-P-P-A, standards, AAMI, AMI, and technical information reports, TRIs.